Next, let's talk about the medications a little bit that we use in treatment of Alzheimer's disease. You have four medications basically that are on the market, but let me give you a little history on how I got to where I am in using the medications. I think this is important too to get an understanding there. When I was a resident, we started out with Cognex. Cognex was a medication that was used to help with dementia, and I never really thought it worked very well, and I stopped using it. Then it came out with Aricept. I tried Aricept. I never really thought it worked so well, so I stopped using it. Then they came out with Exelon. And when the Exelon rep would come around to tell me about the Exelon, I would say, well, yeah, I really don't see much effect in these medications, so I really don't want to use them. And they were persistent enough to get me to try it again. So what they did was I agreed that I'll try it on 5 patients with dementia and see how it works. In the midst of trying Exelon, what happened was I was asked to give a speech on Alzheimer's disease. And whenever I give a speech on something, I really dig in. I really work hard to do all I can to learn as much as I can about the topic so that I can really give a good, educated and good, well-rounded speech on that topic. So what I did was when my first time to give an Alzheimer's speech, I dug in. I spent about 50 hours doing research. Internet, reading, etc., etc. In the midst of that, I had a paradigm shift. Now, this is what's important. My paradigm shift, I began to go back and look at some of the patients that were on the medications that treat dementia. And I began to see, well, there was some improvement. There were some improvements in this. There was some improvement in less falls. There was some improvement in them still helping to dress themselves. Maybe they're still helping to feed themselves. Maybe their activities of daily living, they're still doing more of those. Maybe their speech has not declined as much as those I've seen that weren't on medication. So what I found that there actually was some very significant benefits by going on these medications. And now I routinely will put a person either on Aricept or Exelon, and then the second medication I'll put them on is Namenda. They work in 2 different ways. And what I find is there's a synergistic effect when I put those 2 medications together. There's another medication out, Residine, which also works like Aricept and Exelon. I don't use much of that one personally, but that is another one that's on the market. And I'll use, and they're called acetylcholine inhibitors. And what happens with those is I mix those with the Namenda, and that combination is very, very effective. It's synergistic. When I say synergistic, that means as opposed to 1 + 1 equaling 2, now 1 + 1 may equal 10. And I try all of my patients that have dementia, Alzheimer's disease, I try to get them on a combination of medications. And I find that the effectiveness is pretty significant now that I know what I'm looking for. See, when I initially started treating patients for Alzheimer's disease, I wanted them to get completely better. Like when I treat your blood pressure, it goes from 180 over 110 down to normal. Or I treat your diabetes, it goes from 360 down to under 150, which is a good number of a person that's on medication for diabetes. Although 126 to 70 would be normal. So what I do is I try to get a person on the medication that would get them back to that normal spot. And I try to do the exact same thing when I was treating Alzheimer's disease. Well, it didn't work. Now that I've had the paradigm shift, I try to treat all my patients with this disease process. And what I find is I slow down the decline. That's the biggest thing that happens is you slow down the decline. There will be a decline because we presently don't have a cure. But you slow down the decline. Very, very important.